Hi everybody, Dr. Daniel, and today I'm talking about the side effects of preventive migraine treatment drugs. Well, preventive drugs for migraine are taken orally, while all the CGRP drugs, the new drugs, are given parenterally, which means either subcutaneously or IV, either once a month or once every 3 months. The problem here is that preventive medication would be in one's body for a long period of time, and if that person had side effects from any of the drugs, the preventive side effects could last longer than any acute treatment drug side effect, even after stopping the drug. This is sort of guesswork for me, but I would think the CGRP subcutaneous rendered drug side effects could conceivably last a month or longer because the effect of the medicine on migraine is supposed to last a month, while the usual side effect of any oral, nasal, subcutaneous, or intramuscular administration of a drug may last only days to weeks before the side effects kind of go away. All right, so what are the side effects of preventive migraine treatment drugs? Well, the possible side effects vary from drug to drug, although the CGRP group has a consistent group of very mild symptoms. We'll deal with the older drugs first. What are these drugs? Well, the American Academy of Neurology and American Headache Society has 2012 guidelines for acceptive therapy for medications for prevention of migraine, and they are divalproex sodium, sodium valproate, topiramate, metoprolol, propranolol, and timolol are said to be effective for migraine prevention and should be offered to patients with migraine to reduce migraine attack frequency and severity. So that's a level A recommendation. While frovatriptan is effective for prevention of migraine during menstruation, it also has a level A just during that period of time, which is usually like a week or so for women. So to discuss these drugs sequentially and by alone, we'll talk about Elavil or amitriptyline. Amitriptyline came out in 1961 as one of the oldest drugs used for migraine prevention currently. Although originally intended for treatment of depression by the FDA at doses of 75 to 150 milligrams, headache doctors have successfully used lower doses like 10 to 30 milligrams a day taken at bedtime to help with migraine and trouble sleeping, because a lot of people with migraine have trouble sleeping. Most people with migraine only go to mild stages of sleep, but not deep stages of sleep. A doctor may use it during pregnancy or breastfeeding only for the benefits of taking the medicine outweigh the risks. Amitriptyline has been linked with a small link of problems for the unborn baby if you take it early or late in pregnancies. Okay, common side effects are, it's just a list here. I'm going to read a long list here. Constipation, dizziness, dry mouth, sleepiness, difficulty urinating, drowsiness, dizziness, blurred vision, palpitations, tachycardia, increased appetite, nausea, vomiting, diaphoresis, which means sweating, weakness, disorientation, confusion, restlessness, insomnia, anxiety, agitation, rash, urticaria, weight gain, libido changes, impotence, gynecomastia, galactorrhea, tremor, hypoglycemia, paresthesia, or photosensitivity. Now, serious side effects of amitriptyline are orthostatic hypotension, syncope, ventricular arrhythmia, QT prolongation, AV heart block, torsades de pointes, which is a heart condition, myocardial infarction, stroke, seizures, extrapyramidal symptoms, ataxia, tardive dyskinesia, paralytic ileus, angle closure glaucoma, increased intraocular pressure, agranulocytosis, leukopenia, thrombocytopenia, hallucinations, exacerbation of psychosis, hypomania, worsening of depression, suicidality, SIADH, hepatitis, angioedema, heat stroke, and withdrawal of symptoms if you abruptly stop the drug. Well, what about timolol and metoprolol? These are beta blocker medications indicated for the treatment of hypertension, cardiovascular event prevention, post-MI, and for migraine headache prophylaxis. Propranolol is a beta blocker drug indicated for hypertension, atrial fibrillation/flutter, supraventricular arrhythmias, cardiovascular event prevention post-MI, for angina and essential tremor. IHSS, which is idiopathic hypertrophic subaortic stenosis, and also for migraine headache prophylaxis. Side effects of timolol, metoprolol, and propranolol are serious side effects are congestive heart failure, severe bradycardia, heart block, angina worsening if abrupt DC of the drug, myocardial infarction if abrupt DC of the drug, ventricular arrhythmia if abrupt DC, Raynaud phenomenon, bronchospasm, hypersensitivity reaction, anaphylaxis, lupus erythematosus, or myasthenia gravis exacerbation. Now, common reactions from taking timolol, metoprolol, or propranolol are bradycardia, fatigue, dizziness, headache, dyspnea, pruritus, nightmares, and impotence. Moving on over to divalproax sodium and sodium valproate. These drugs are indicated for treatment of epilepsy, bipolar disorder, and migraine. Depakote can be a useful single preventive drug if the patient has both migraine and epilepsy, bipolar disorder and epilepsy, or migraine and bipolar disease. Those kind of illnesses come in clusters and are really comorbid. Serious side effects of divalproax sodium or sodium valproate are hepatotoxicity, pancreatitis, SIADH, hyponatremia, pancytopenia, thrombocytopenia, drug reaction with eosinophilia and systemic symptoms, hyperammonemia, hypothermia, myelosuppression, aplastic anemia, bleeding, erythema multiforme, Stevens-Johnson syndrome, toxic epidermal necrolysis, anaphylaxis, hallucinations, psychosis, suicidality, encephalopathy, coma, cerebral pseudoatrophy, Parkinsonism, and polycystic ovary syndrome. Common reactions of these drugs are headache, nausea, vomiting, asthma, somnolence, dyspepsia, dizziness, abdominal pain, tremor, alopecia, weight changes, appetite changes, constipation, nervousness, emotional lability, insomnia, peripheral edema, petechiae, ecchymoses, rash, depression, dyspnea, tinnitus, ALT or AST, elevated blood test, amnesia, abnormal gait, injection site pain, vision changes, blurred vision, nystagmus, myalgia, or photosensitivity. A possible severe reaction is fetal malformations in pregnant women. It should be never given to a potentially fertile women. Next, I'm going to deal with topiramate. This drug is indicated for treating partial seizures, primary generalized tonic-clonic seizures, Lennox-Gastaut syndrome with seizures, and for migraine headache prophylaxis. Serious reactions for topiramate are severe metabolic acidosis, nephrolithiasis, osteomalacia, oligohydrosis, hyperthermia, hypokalemia, hyperammonemia, encephalopathy, psychosis, suicidality, leukopenia, anemia, secondary angle glaucoma, acute myopia, maculopathy, Stevens-Johnson syndrome, toxic epidermal necrolysis, erythema multiforme, hemorrhage, pediatric growth suppression, and withdrawal seizures if there's an abrupt discontinuation of topiramate. Common reactions, though, seen in the clinic would be cognitive dysfunction, paresthesia, somnolence, hyperammonemia, URI, dizziness, weight loss, fatigue, nervousness, ataxia, anorexia, abdominal pain, taste changes, nausea, visual disturbance, fever, diarrhea, mood disturbance, nystagmus, insomnia, depression, tremor, infection, bleeding, dyspepsia, hyposthesia, asthenia, anxiety, and phosphate decrease in your blood work. Next, I'm going to talk about Frova or Frovatriptan. That's a long-acting triptan indicated for acute therapy of menstrual migraine, also used prophylactically for menstrual migraine taking the drug for 6 possible days per cycle. So it lasts it's 26 hours. The onset of drug is within 6 hours. And so a lady would take one of these pills every day during her cycle for 6 days. Serious reactions to frovatriptan are coronary vasospasm, myocardial ischemia, MI, ventricular tachycardia, life-threatening arrhythmia, hypertension, stroke, cerebral hemorrhage, subarachnoid hemorrhage, intestinal ischemia, peripheral vascular ischemia, hypersensitivity reaction, anaphylaxis, angioedema, serotonin syndrome, headache exacerbation. If you use more than 10 days per month, you can get rebound headache or medication-induced headache from frovatriptan if taken too often. Common reactions are dizziness, fatigue, flushing, paresthesia, headache, xerostomia, hot sensation, cold sensation, arthralgia, bone pain, dyspepsia, chest, neck, or jaw pain or discomfort. Well, what about the newer drugs? Nurtec 75 milligram ODT came out in 2020, and in May of 2021, Nurtec has been approved for the FDA by both acute and preventive treatment for migraine. It's the only drug in the world for both indications for prevention. It's administered every other day. Nurtec ODT the migraine process releases 3 neuroinflammatory chemicals, CGRP, neurokinin A, substance P, and Nurtec ODT blocks the effect of CGRP, which now are considered to be one of the most important inflammatory neurochemicals during the migraine process. ODT here means orally dissolvable tablet. The tablet is put in the mouth and then it dissolves. Water and a cup of or a glass are not needed. The drug effect occurs in early an hour after taking Nurtec. It's safe with migraineurs with cardiovascular risk factors. And Nurtec ODT is compatible with most drugs, including CGRP preventive medication for migraine, oral contraceptives, some antidepressants. Preventive medication for migraine is listed above, and triptans for migraine. Okay, what are the possible side effects of taking Nurtec ODT? Serious ones are an adverse reaction. It may cause a serious hypersensitivity reaction with trouble breathing, rash, swelling of the face, mouth, tongue, or throat. Common mild side effect is nausea, present in 2% of person. Next, I have Aimovig, which is a new CGRP blocking preventive drug for migraine, and it blocks CGRP, also a neurochemical, to improve migraine attacks. This drug has few side effects and can be taken safely with all drugs known. It is given by subcutaneous injection every month at a dose of either 70, 100, or 140 milligrams. Serious side effects are hypersensitivity reaction, anaphylaxis, severe constipation, and hypertension. Common side effects are injection site reaction, constipation, and muscle cramps or spasms. The serious side effects are rare, and the common side effects are not that bad. Constipation may occur in 3% of patients, but it improves with time. And the injection site reaction is like the small bruise one gets following having blood drawn in your arm for getting lab studies drawn. So this drug is, like all the new CGRP drugs, pretty free of serious side effects. Ajovy is also a CGRP blocking preventive drug for migraine. It's given subcutaneously in adults monthly. It has mild side effects. It is listed that serious side effects may occur, but none have been reported for this drug. Common reactions are injection site reaction, a hypersensitivity reaction, rash, pruritus, and urticaria. Emgality is also a CGRP blocking drug for migraine. Serious side effects are the hypersensitivity reaction, and common side effects are injection site reaction and muscle cramps or spasms. Select safety information is listed in that Emgality may cause allergic reactions such as itching, hives, rash, or trouble breathing. Allergic reactions can happen even days after using the drug. Yapeti. Yapeti has been approved for both episodic and chronic migraine. It's a monoclonal antibody inhibitor of CGRP. It's given by IV infusion monthly, so you have to go to a perfusion unit to get this drug. Serious side effects are hypersensitivity reaction, and common reactions are nasopharyngitis, angioedema, urticaria, facial flushing, and a rash. Botox. Well, that's onabotulinum toxin A. It's colloquially known in the world as Botox. It's a famous dermatology, beauty-assisting, facial line erasing drug, which also works for chronic migraine headaches and has an indication from the FDA for migraine prevention for patients with chronic migraine, which is 15 headache days a month, 8 of which have migraine features. Botox does not work for episodic migraines, which is 14 or less headache days a month, or for tension-type headache. Botox is a neurotoxic protein produced by the bacterium Clostridium botulinum, and it prevents the release of the neurotransmitter acetylcholine at the neuromuscular junction. This can result in paralysis of striated muscle found in the eye muscles, diaphragm, arms, and legs. Serious reactions are a hypersensitivity reaction, anaphylaxis, toxin effect spread, so you give it one injection around the eye and it goes to the forehead or something like that, dysphagia, respiratory failure, autonomic dysreflexia, urinary retention, retrobulbar hemorrhage if you give it around the eye, or corneal ulcer, myasthenia gravis exacerbation, facial paralysis, and or seizures. Common reactions for Botox are ptosis, if you inject it around the eyelid, UTI, ocular vertical deviation, so you get double vision because the eye muscles are affected, neck and extremity pain, superficial punctate keratitis, ocular dryness, headache, fatigue, anesthesia, muscle weakness, sweating, fever, infection, hematuria, dysuria, nausea, pruritus, arthralgia, myalgia, back pain, and appetite decrease. Okay, well, this concludes my analysis of possible side effects from using the usual preventive drugs for migraine. I would suggest you go to my blog post on this at www.migraine.com because I have that all written down. It's easier to look at. I know this is just kind of a long list of side effects, but some people want to know that hearing it, and they learn better hearing things than reading. Thanks for listening to this, and listen to my other podcasts available to you. See you again on the next talk.